frequency distribution is histogram. Sensitivity formula is total true positive by true positive plus false positive into 100. Sensitive formula is true positive divided by true positive plus false negative multiplied by 100. A pharmaceutical company introduced a new pregnancy kit. It shows out of 100 pregnant women, 99 were positive, and out of 100 non-pregnant women, 90 negative. Sensitivity is 19. Sensitivity formula is A by A divided by A plus C into multiply 100. From 1970 to 1995, 500 people were exposed to smoking 400, non-exposed 100. Out of 400, exposed 50 developed lung cancer, and out of 100, non-exposed 5 developed lung cancer. Calculate relative risk. Its answer is 2.5. Formula is incidence of disease among exposed divided by incidence of disease among non-exposed. Disinfection and miscellaneous. Inertiation is to avoid water contamination. So inertiation is to avoid water contamination. Occupational things. Greenhouse gas includes CO2, ozone, methane. greenhouse gas include CO2, ozone, methane. Health planning, care and management in India. So, population covered by PHC in plains. Population covered by PHC in plains 30,000. Kartar Singh Committee is a multi-purpose worker scheme. As per norms, pharmacist and lab technician are suggested per how much population? 10,000. In a district hospital, the requirement of special newborn care beds is in a district hospital. Requirement of special newborn care beds is 16. ASHA covers how much population in a plain? 1,000. Number of visits to be carried out by ASHA in a home delivery? 7 times. Under RNTCP, rural lab covers how much population in plains? 1 lakh. Disaster management, disinfection and BMW management. Most common reported disease in post-disaster period: acute gastroenteritis. Best method for waste disposal when suitable land available. Best method for waste disposal when suitable land available. Controlled tipping. Human anatomical waste are disposed of in yellow bags. Most important step to be taken before disaster: mitigation and preparedness. First step to be taken post disaster: response and rehabilitation. Which ministry will be responsible for rehabilitation post disaster? Ministry of Home Affairs. In a tray, black color is for unsalvageable. Body fluids and fetuses are classified under which category of waste? Pathological waste. Family planning and contraception. Highest contraceptive failure. spermicide, highest contraceptive failure is spermicide. A woman from village delivers her seventh baby and she wants contraception. When is the ideal time for immediate postpartum IUD insertion? Within 1 week of delivery. Unmet need for contraceptive means family planning in those who are not using any contraception. Definition of Pearl Index is failures per 100 women years of exposure. Pearl Index is used to measure the contraceptive efficacy and contraceptive failure. So, calculated by failures per 100 women years of exposure. Hundred females used contraceptive for 1 year, there is one failure. How much is the accidental pregnancy rate? 0.01. It is calculated by total accidental pregnancies divided by total month of exposure multiplied with 1200. Environment and health. Horrocks apparatus is used for calculating bleaching powder dose for water disinfection. Hospital infection is known as nosocomial infection. Best index for calculation of nutrition value of protein. Best index for calculation of nutrition value of protein. Serum albumin concentration. Best index for measurement health indicator in society. Infant mortality rate. Which of these has the max natural source of vitamin A? Halibut liver oil. According to WHO, marker for obesity index is Quetelet index. Nowadays, which is the most common pasteurization method? High temperature and short time method. Waist to hip ratio that increases risk of cardiovascular disease is more than 0.85 in female. For men, it's greater than 1. For women, more than 0.85. Food adulteration can lead to beriberi, polished rice. True about low glycemic index food. Reduced peak and prolonged absorption. The glycemic index for glucose is 1. Richest source of linoleic acid. Safflower oil. Plant source with highest protein. Soya bean. What is the dose of iron folic acid given till 6 to 10 years? 20 mg iron with 0.1 mg Fa. Folic acid. Total calories required for a male with moderate activity. 2,730 kilocalorie per day. 2730 kilocalorie per day. Total calories required for a meal with a moderate activity. How many calories are there in 100 ml breast milk? 60 to 65. W or DA vitamin B12 in pregnancy. 1.2 MCG. Epidemic dropsy is caused by this toxin. Sanguine narine. Which test is done at subcenter during pregnancy? Hemoglobin. For doctor to practice MTP, minimum number of MTP to be performed is 25. A 28-year-old lady, G2P1, does not want to conceive again immediately after first trimester abortion. Which of the following is the best method for her? IUD. How much additional calories per day is required in a pregnant lady? 350 kilocalorie. Most common cause of low birth weight in India. intrauterine growth retardation. According to WHO, all are true about reduced osmolarity ORS except glucose minus 90. Glucose is 75. Glucose 90 is not osmolarity, which causes true about reduced osmolarity in ORS. Content of glucose must be 75 millimole per liter. Iron required in lactation 20 mg per day. Total calories required for a female with sedentary activity is 1900. Total osmolarity of reduced osmolality ORS is 245 millimole per liter. It's 245 millimole per liter. National health programs and policies. Which of the following is not correct about urban malaria scheme? Includes area with slide positivity of more than 10 cases per 10,000 smears. Blood smear for malaria is collected by male multi-purpose worker MPW. Sputum for AFB is collected at village level by health worker male. Active surveillance of malaria is done by multi-purpose worker. Suraksha clinic is for RTA, reproductive tract infection, and STD, sexually transmitted disease. Ujjwala scheme is for child trafficking. Under Vision 2020, in a school eye screening program, a teacher checks vision of a student will refer to which center? Service center. HIV targeted intervention not done in which population? Street children. Program included in NRHM is National Vector-Borne Disease Control Program, Revised National Tuberculosis Control Program, Iodine Deficiency Disorder Control Program. Which of the following is not emphasized in school health service? Lung infections. Which is not the work responsibility of ASHA? Delivery at home. true about incentives given to ASHA worker in Janani Suraksha Yojana is 400 INR to ASHA and 1000 INR to mother in urban area low performing states. An IQ of 55 comes in which category? Mild mental retardation. One male health worker, one female health worker should be present at each PHC. This is given by which committee? Carter Singh Committee. Communicable and non-communicable disease. Amplifier host of Japanese encephalitis. Amplifier host of Japanese encephalitis. Big. According to WHO, which one is a notifiable disease? Yellow fever. Amount of sodium in ORS as per WHO 75 millimole per liter. In the case of measles, post-exposure immunoglobulin can be given within how many days after exposure? 3 days. In a case of cholera, period of isolation is for 7 to 14 days. How much is the daily iodine requirement of a 3 to 5 month old child? 100 to 120 MCQ per day. Advantage of adding zinc with ORS is reduces duration of diarrhea. Disease which does not require vector for transmission. Fever. Q fever. Correct about leproming test. It classifies the type of leprosy. Dose of vitamin A to a 2-year-old child with keratomalacia. 2 lakh international unit thrice every 6 months. Correct about initiating treatment in an adult patient with AIDS. No cutoff of CD4 count required for initiation of treatment. Cattle and sheep livestock is natural host for Crimean Congo fever. Chickenpox infection is centripetal distribution. Most common clinical feature of tularemia. Lymphadenopathy. Quinton fever is caused by Bartonella. Culex mosquito is a vector for Japanese encephalitis. What is the color of RTI STI kit number 6? Yellow. Black RTI kit is used in inguinal bubu. Which cancer is preventable by vaccine? Cervix. Incubation period for cholera. Few hours to 5 days. Epidemiology, screening and vaccines. BCG is diluted with NS, normal saline. Vaccine storage at level of PHC, ice line refrigerator. In a baby who is on steroids, live vaccine can be given after 4 weeks. Live vaccine are contraindicated in pregnancy except yellow fever. Food poisoning is an example of point source epidemic. Diabetes, hypertension or CAD. Screening should be started after the 45. Actually 40, and age group is 40 and above. Neonatal tetanus prevention is best done by tetanus toxoid. True about incidence. Number of new cases. Only vaccine given to adults is DT, diphtheria tetanus vaccine. In a case of epidemic, 3 villages are affected simultaneously with typhoid cases. Upon study, it is found that one milkman is going to all these 3 villages. Identify the type of epidemic. Common source, continuous exposure. When some people develop a disease after exposure from a primary case, it is known as secondary attack rate. In situation of an epidemic, what is the medical officer first to do? Confirm epidemic whether it exists in real. Net reproduction rate is defined as number of girls born to a woman during her lifetime, assuming mortality. If net production rate is desired to be 1, what should be the couple protection rate? 60. Lung cancer patients, 300 smokers and 300 non-smokers, 10-year history taken, what can be calculated? Odds ratio. What is the recommended dose for human rabies immunoglobulin in 4-month-old child? 20 international unit per kg. What is the recommended dose for the human rabies immunoglobulin in 4-month-old child? 20 international unit per kg. What is the measles vaccine dose? 0.5 cc. Reconstructed Japanese encephalitis vaccine at 2 to 8 degrees can be stored up to how many years? 3 years. Sentinel surveillance it includes notifiable cases. Varicella zoster immunization is given to all except patients with varicella zoster. Study designs and preventive measures. True about quarantine. Restriction of movement of healthy contact of an infectious disease. True about quarantine is restriction of movement of healthy contact of an infectious disease. Fmge study is prospective cohort. Incidence can be calculated by cohort study. Fmge hot study comes under cohort. Hospital patient admission rate differs in different hospitals with different disease. This causes which type of bias? Bergsonian bias. Fetal cardiac monitoring is a type of secondary prevention. Relative risk calculation is done for cohort study. Concept of health and disease. True about QLI, physical quality of life index, life expectancy at 1 year, infant mortality rate, literacy rate. Yellow fever vaccine is valid for lifelong. Breastfeeding should be continued for minimum how many months? 6 months. Subacute sclerosing panencephalitis is a rare and dangerous complication of measles. Anthracosis is caused by coal dust. Patients are categorized on the basis of chances of survival in disaster management. Is triage. Which is not a measure of dispersion. Mean. N95 mask is used for respiratory droplets. Target couple is couple that is eligible for practicing family planning. Worms and bugs attached to clothing of a person is called as contamination. Sustainable Development Goals is designed by United Nations. Kyoto Protocol is for to reduce greenhouse gas emission. Spermicidal cream which is used in contraceptives, nonoxynol 9. Main focus of UNICEF is on child health. Recycling, tubing and recyclable catheters will be disposed in which bag according to biomedical waste management. Recycling, tubing and recyclable catheters will be disposed in red. A person comes with the right eye 6/60 and the left eye 3/60. He shall be categorized into which type of blindness? Economic. On Republic Day, a camp was organized and people were screened for hypertension by checking BP and for diabetes by checking their BMI and blood sugar level. Which level of prevention is this? Secondary. Under ICDS, intersectoral coordination is found with NRHM, National Rural Health Mission. A doctor is teaching an intern about knee reflex demonstration. What type of learning is this? It is psychomotor learning. Which of the following are includes in NPCD-CS? That is CVD, cancer, diabetes, stroke are included in NPCD-CS. There is a group of 200 hypertensive patients. First group of 100 patients follow medical advice, whereas second group of 100 patients follow lifestyle advice. There is test for both the groups after 3 months. Which of the following is the best test for significance of compare blood pressure levels in both the groups? Unpair students test. Students T test. Unpair students T test. Under ESI, after certification by medical officer, beneficiaries get 70% wages for 3 months. Under sickness benefit. Newborn birth rate is 25 per thousand population in a village with total population of 5,000. The total number of pregnancies per year is 138. Maximum level disinfectant property is seen with glutaraldehyde. Prevalence is associated with positive predictive value. Which agency collects data and publishes large-scale survey continuously regarding morbidity, family planning, vital events? National Sample Survey. Urban Heart is HEART. Urban Heart is Urban Health Equity Assessment and Response Tool. Vector of Zika virus disease is Aedes aegypti. A 22 years old low socio-economic female worker present within 8 hours of sexual assault on 13th day of cycle and asked for emergency contraception. What will be medication. LNG 1.5 milligram, levonorgestrel, levonorgestrel 1.5 milligram. A woman who is lactating came to OPD 6 weeks after delivery for checkup and to get advice for the contraception. Which is not advised. Combined OCP is not advised. Which is advised is IUC. A health worker nurse got an accidental prick with HIV positive needle. Parameter used to test for confirmatory diagnosis is a confusion in this answer. In some books, it's given as Western blot assay. But in part 20 studies, they have given us P24 antigen. When I come across marrow, saw it as a Western blot assay. Confirmatory diagnosis. STD kit color for female with vaginal discharge. Kit 1 grey color. Why a translucent bag is used for disposal of sharp waste. Mortality is taken into consideration in net reproduction rate. Sample registration system does not include maternal mortality rate. A research study is being conducted on patients in rehabilitation where impact of addiction among young adults was assessed on their subsequent divorce. Among two groups of study subjects, divorced and non-divorced, history of alcohol drug use was assessed. What kind of study was done? Case control study. One ASHA worker in rural area is designated for how much population? It's 1,000. 1,000. A screening test is used for disease in a population. And what are the second and third point? If the screening test is second and third, that is screening test. The second and third point represents screening time. during the first possible detection to critical point is said to be screening time. NITI Ayog has replaced National Planning Commission. Rabies-free state in India is Andaman and Nicobar Island. SARS is caused by novel variant of coronavirus. Least iron content is present in milk. A nurse spilled blood on floor. The best disinfectant used to clean is 1% sodium hypochlorite. Delphi technique used for collective opinion of a group. Mid-year population is taken on 1st July. First investigation for TB diagnosis in real HIV, persons living with HIV, is sputum smear examination. For a pregnant female, minimum number of antenatal visits required are 4 visits. First investigation for a suspected case of pulmonary TB. Sputum smear examination. For the first investigation of TB diagnosis in persons living with HIV is CBNAT. CBNAAT. But for suspected case of pulmonary TB, the first investigation is sputum smear examination. Okay, thank you.